The Human Optimization Podcast is proudly brought to you by Vicon Supplements, where quality meets sustainability. Vicon's all-natural supplements are handcrafted and sustainably produced in Canada, bringing you products that nourish both your well-being and our planet. Visit viconsupplements.com today and be a part of a greener, healthier future.
Are you ready to embark on a journey to the best version of you? Join me, Lisa Pitel-Killah, as I dive deep into the world of hair tissue mineral analysis and functional medicine with fellow experts, and guide you on the path of unlocking your full potential. As a multi-time kettlebell sport world champion, I'm on a mission to reach high-performance professionals from around the world to help you minimize tiring symptoms, maximize health, and gain unstoppable energy. This is the Human Optimization Podcast. Welcome, everybody, to a brand new episode of the Human Optimization Podcast. I am your host, Lisa Pitel-Killah. I have Dr. Julianna Lindsey here with me today, and you are going to love this chat. And we have a way for you to get your hands on something that I think you're really going to like too. So make sure you pay attention till the end. So Dr. Lindsey is board certified in internal medicine with additional training and certifications in anti-aging and regenerative medicine, functional and integrative medicine, lifestyle medicine, bioidentical hormone optimization, and peptide therapy. One of my favorite things. In addition to her clinical work, she spent the past 15 years serving executive leadership roles at Fortune-level companies. During this time, she observed the dysfunction of our healthcare system on a large scale, an experience that contributed to her motivation in establishing her Radiant Longevity Clinic in Southlake, Texas. She dedicates her life to serving people through personalized care and attention. She is the author of Radiant Longevity, a physician's protocol for living your best life, which I am holding. If you're watching on YouTube, you can see it. And we're going to talk all about Radiant Longevity today and dive into some really cool insights into the book as well. So, Dr. Lindsey, welcome to the podcast.
Thank you so much for having me, Lisa. I love your work.
Well, thank you. And I love your book. So I want to start there. But before we dive into that, and I get into all of my questions, tell us a little bit more about your background. There's always a reason why we're here today and how we got down this road. I know our viewers and listeners always love to hear about our guests.
Well, thank you for asking. Most of my career has actually been spent in physician leadership and management. My goals for healthcare early in my career was to make healthcare safer in the United States for patients to get. So as you know, patient safety is a real issue. There are a lot of accidents that happen in hospitals, and a lot of those are preventable. So I engaged in that process for about 20 years. The 20-year anniversary of the report done by the Institute of Medicine called To Err is Human, showing that a jumbo jet and a half full of people die from medical errors in the United States every single day.
Wow.
Yes, it was. And that was at the time I was starting my residency. So I thought that was a good thing to focus on. So spent 20 years. I was able to achieve working in very high levels in the United States through being on the National Board of Examiners for the Malcolm Baldrige Award, the National Medical Director for Hospital-Based Physicians for a large publicly traded hospital company. I've consulted all over the country. At that 20-year anniversary, a report came out stating that we had made zero progress. So just as many people were dying 20 years later as were when that Institute of Medicine report was written. So after 20 years at working at this level, trying to make healthcare safer, and a lot of other people working on the same, a lot of check boxes have been ticked in the 20 years. If we haven't moved the needle by now, I decided I needed to go and redirect my efforts toward caring for individual humans. This is where my heart has always been anyway, to prevent people from getting sick. Let's keep them out of the hospital. Let's keep people at that high level of functioning where they can contribute to their families, their communities, live a happy life. And let's extend their health span. And I think that will
Absolutely.
ultimately make patient safety improved in the United States.
Yeah. Well, and I love that you use Healthspan, right? It's I feel like a lot of people, I feel like some people, maybe I've never heard of it. It's a new term. It's not, but we talk about lifespan, longevity, but health span is a totally different thing, right? We want to be healthy for that period of time, not just living and unhealthy as well, right?
Yes.
And you identify a lot of intentional things for lifestyle, diet, right? Sleep, right? Some of the main kind of pillars of that holistic health when it comes to taking care of ourselves at the end of the day, right?
Absolutely.
And I'd love to dive in a little bit because, again, I think one of the hardest things is you mention a lot of fad diets, right? In your book, you review some of them, and that's, I feel like, even as you and I kind of navigating online, there's things we come across and we have to, think about it. But in the health space, people can Google so many different things and it's so there's so much information out there. I can't even imagine how, I think, almost like buried people feel because they don't know what to believe. They don't know what to do. And there's so many options they can't even choose. And that's a really hard spot to be in. And I think that's where some of the dieting comes in, right? They're like, oh, let's do keto and now I'm going to go carnivore. I'm vegan, whatever. Touch on that because that can be a detriment in itself, especially for bouncing around to different nutrition plans and really trying to dial that in. That can be really hard on the body too.
I totally agree, Lisa. And there's so much noise out there around diet, and most everybody is trying to sell you something. So
Yeah.
when people are selling a product, please always take that into consideration because there's a secondary gain there. I like to keep diet very simple,
Mm-hmm.
both in what to do and what not to do. So the thing to do is a whole food diet. You want to eat food and it's close to the form that nature gave it to us as possible. Now, by all means, cook your meat, cook your vegetables, etc. But you don't need the carrot cake. The the second thing is what not to do, and I would highly recommend people get highly processed foods out of their diets. It is killing Americans. Not only killing us, but it is making us sick and chronically ill, and that starts in childhood. I mean, as you know, there's
Yeah.
a childhood obesity epidemic,
Mm-hmm.
and I believe that those highly processed foods are an important part of that.
I agree. I agree. And you mentioned childhood obesity epidemic, and that's exactly what we have right now, right? And that is a scary thing. It's almost like I kind of think sometimes we're so busy with all the things, right, that every day entails, that we have forgotten even something so simple. Like I remember when I was growing up, we had a lot of sports on the go and what have you, but dinner was always at the table with the family, right? We sit down for dinner, we take our time to eat, right? Where now I find a lot of people are eating on the go and then they're not digesting as well as they should. And then that's affecting them too.
Absolutely. And eating on the go often involves not only the processed foods that they may be picking up for convenience, but those processed foods are often served in plastic. They
Right.
grab a water bottle that's plastic,
Yeah.
and that's a whole other issue. Plastics in our
Absolutely.
environment.
Absolutely. Absolutely. And I think that we think now they're better, right? We think the plastics are made better. There's no BPAs, there's all, but we still have a problem, right?
Yeah.
One of the things, and this is just something kitchen based, I was thinking about, and I heard it the other day, somebody was talking about it on the radio, and it was about the microplastics in cutting boards that are plastic
Yes.
that then you're consuming,
Yes.
right? And that is a pretty big eye opener that I think a lot of people don't realize.
That's one of the things I've recommended all of my patients: get rid of your plastic cutting boards.
Yeah.
And many people don't think about the coffee pods that they use for
Oh,
convenience, the single serve
yes.
coffee pods.
Yes.
When you put heat on plastic, some of that plastic is going to get in your food. So I'm highly
Makes.
recommending people grind their beans, brew their
Yep.
coffee.
Yep. Absolutely. And that's very true. The other thing too, some of them are, I think they're actually aluminum based as well. That's
Yes.
not good either, right?
I'm not
Yeah.
sure. I'm not sure how much of that gets because aluminum is more heat stable than plastic.
Yep.
And the answer is I just don't know. I don't
Mm-hmm.
know how much aluminum is actually getting into the food.
Yeah.
I think I would take my chances with the metal versus
Versus the plastic.
yeah.
Yeah.
And
Yeah. Yeah. Makes sense. Makes sense. And, one of the things that you talk about is, we're talking about radiant longevity, right? We're talking about Healthspan and healthy aging. What are some of the things that you think, or even maybe 3 or 4 kind of pillars that you think really contribute to that you drive home with patients?
sleep, of course,
Yeah.
fundamental pillar of health. Your nutrition, fundamental pillar of health. How often and how much you move your body is
Mm,
important. And then the fourth thing I would throw in there, which is non-negotiable, is how you manage your mindset around aging and longevity.
absolutely. Let's dive a little into that. That is, I feel like mindset is a big topic for me. I think about maybe using it, for example, visualization techniques, right? A lot of times before competitions, I'll sit down with athletes and kind of talk them through a visualization, but it's about setting the stage for that mindset. And I think it's important to, I said in another podcast last week, I said, we really are all athletes. If we would treat ourselves that way, we
Absolutely.
we would be so much better off.
Mm-hmm.
Because
Yes.
you spring out of bed every day, or maybe not spring, but we get out of bed every day, some of us, right? And you run a marathon all day long,
Yes.
right? And we have to fuel ourselves for that.
I completely agree. And that is one of the things I'm an aerialist is
Mm-hmm.
one of the forms of exercise I partake in.
Oh, fun.
Yeah. And in the aerialist community,
Yeah.
I really try to encourage and it's mostly women, it's 99% women,
Mm-hmm.
to treat their bodies like the athlete that they are.
Yeah.
And that expands obviously to people who aren't in formal athletics,
Mm-hmm.
but our body carries us through this life.
Absolutely. And I always think about, like, treat it like the rare gift that it is,
The
right?
rare, beautiful individual
Exactly.
that we have. Yes.
Absolutely. So give me, sleep is important. I think
Yes.
a lot of people nowadays maybe don't sleep as well as they should. And I think sometimes it's not a priority as well. But there's also some tactics to be able to help people get to sleep, have better sleep. What are some of the things that you find really important for that?
The first thing I would say is it's hard to know how much you're sleeping or how well you're sleeping if you're not tracking your sleep.
Right.
So I think the first thing that you need to do is get data around your sleep.
Mm-hmm.
Without that data, it's hard to know how to act to improve your sleep, right?
Right. Yeah.
Of course, there's all kinds of things like sleep hygiene, super important, avoiding caffeine, and also just large volumes of liquid before bedtime.
Yeah.
Keeping your circadian rhythm right by getting early morning sunlight in your eyes on your retina. That's
Mm-hmm.
important to having a normal sleep wake cycle. Not eating too close to bed, but that lots of things like that.
Mm-hmm.
A cool sleeping environment helps a lot of people achieve better sleep. But without knowing the data around your sleep, it's hard to know where your intervention needs to lie
Right.
and if that intervention is effective or not.
Absolutely. And one of the other things that I find is the room has to be dark,
Oh,
right?
great point. Absolutely.
Yeah,
Absolutely.
like if you've got, like, I even find sometimes, and I am an early sleeper, so by 8:30, 9 o'clock, I'm in bed. So the sun might still be out in the summertime, right? But so I put my sleep mask on. I might not wake up with it on, but I put it on when I go to bed because then it blocks, right? And I never travel without my sleep mask, my
Hmm.
magnesium, and my earplugs, right? Because
Excellent.
that if you have that stuff, like, you can sleep anywhere. Right.
Certainly helps.
It certainly helps for sure. Because I think, sleep helps us recover.
Yeah, it's when
It
our
helps.
body repairs itself.
Exactly. So if we're not sleeping, we're not doing ourselves any good service there for repair and recovery.
And if you are mindful about maintaining your weight,
Hmm.
it is nearly impossible to lose weight in a sleep deprived state.
Yep.
It's also much harder to maintain your weight. It just having your cortisol levels all out of whack.
Yep.
It's just not good for anything in our body. Not good for our brain, body, anything.
Absolutely, for sure. Well, and so let's dive back in now too. I want to talk about, like, measurements. What are some of your favorite tools for people to get that data? Like,
For sleep.
yeah, well, sleep, I mean, there's lots of data that can come out of, like, I mean, I have an Alter Human that I wear. So there's like HRV, my heart rate, right? So there's lots of things I can take from it. Sleep is one of them. What are some of the things you like to recommend or use yourself?
So it's easy to get overwhelmed with the data
Yep.
from the devices.
Yep.
I think a good place to start is looking at your sleep onset and latency. Are
Mm.
you getting in bed at a regular time?
Yep.
Are you getting to sleep in a reasonable amount of time?
Hmm.
And then look at the total hours of sleep that you're getting. It's hard to know without tracking your sleep how many times per night you're waking up. You
Right.
don't realize it when you get up the next day, these micro wakings, but your body feels it and your overall sleep duration suffers from it. You may be in
Mm.
bed 9 hours and get 6 hours sleep.
Right. And that's true. And if people don't know that, they don't know what they have to fix because they don't know what's wrong. With regards to, like, targets and longevity, things like that, let's go back to attitude and the attitude around longevity and aging. Some of the things you talk about in your book as well are nurturing that attitude. I talked about visualization for athletes, things like that, but there's also other ways that we can prevent the negative self-talk and some of these things that I feel like we kind of fall into patterns sometimes, but it really takes active focus to change it.
I agree. And I think that starts with evaluating how we talk to ourselves, how we speak to
Yeah.
ourselves.
Hmm.
Most of us are our own worst critic.
It's true.
Um, we need to be able to give ourselves the break and the grace that we give to our friends and our family. We
Yeah.
deserve that. And when you don't, you can just get into this negative spiral that is so detrimental to, again, mind and body. So a positive mindset, it affects our cognition,
Hmm.
immune system, our cardiovascular system, every part of our body. In fact, this is an interesting validated statistic. Optimists live on average 18 to 13 years longer than people who have a pessimistic attitude.
Wow. Really?
If that's not a reason to work toward a positive mindset, I'm not
Yeah.
sure what is.
Wow, that's incredible. And I can understand it because I feel like too sometimes there's a very strong correlation, I think, between our mindset or attitude and what we manifest in our lives as well.
I think so too. You kind
Yeah.
of, well, we know that people who expect to age well actually age better. Their health span is longer.
Yeah.
If people expect to decline as they age, then they're going to experience that.
Yeah, I agree. It's funny too, because, I'm in my 50s now and I have friends. Well, oh, this is that. I'm just getting older. And I'm just like, oh my gosh, no, you're not. Drives me crazy.
Equally, yes.
Right. It's like, no, you can change this. You have the power to do, whatever you set your mind on. Doesn't matter how old you are.
And we have to separate what we have power over and what we have the will to do.
Right.
And
Yeah.
we have a lot more power over our health and well-being than I think a lot of people give us credit for. Just
Absolutely.
because something's in your genetics doesn't mean that you're necessarily predestined for it.
Absolutely. I couldn't agree more on that. And so let's talk a little bit about genetics, because I do think sometimes it's a hang up for people, or sometimes it's an excuse, right? Well, I have that, so I can't, right? So
Yeah.
I feel like sometimes it's, when we're talking about longevity and we're talking about good aging and all the things, we have to really put a good, I don't want to say description, I don't think that's the right word, but just around the genetic piece so that people understand there's more to it than just that.
There's so much more to it than just that. Obviously, our genetics provide our foundational blueprint for how our body functions and our lifespan potential.
Mm-hmm.
And it does that by influencing how resistant we are to disease, how efficiently our cellular processes work. But there is a important dynamic and interplay between our environment and our lifestyle choices that ultimately affects not only our lifespan, but our health span.
Mm-hmm.
So the epigenetics, or how our genes express themselves, are highly, highly influenced by our lifestyle choices.
Yeah, absolutely. Well,
Diet,
and
exercise matters.
well, and I think epigenetics, that this is, again, term people may not realize, been around for a long time, but there's a lot to be said for that, about the way we can dim the switch, turn the switch on, off. There's so many things that we can support. I know for myself, I have homozygous C677. So for those of you who know anything about MTHFR, it means I detox at about a 30% capacity out of 100. But there's things that I use every day to help with that, right?
Absolutely.
You're right. So there's so many options.
Yes. And knowing your genetics, knowing that foundational blueprint allows us to help people. And we do a lot of anonymous whole genome sequencing in my clinic.
Mm-hmm.
Highly recommend that be done anonymously, because
Yep.
every information is for sale and you don't want that out there, because that is
Yep.
your most private information. But by doing the whole genome sequencing, we can see what people are predisposed to. So it really helps us tailor a health plan for them to mitigate their risk. Like for someone who has a lot of defects in the methylation pathway, and there are so many genes involved in those pathways, we provide a lot of methylation support for those people. And it's not just about methylated B vitamins either. Those are important for people who don't methylate well. But having methyl donors and just other types of methylation support is super important for those people, more so than somebody who doesn't have as many methylation defects.
Absolutely. Absolutely.
Methylation is I'm sorry, Lisa, is how our body turns our DNA off and on. I mean, that's a super important process.
Yeah. Yeah, for sure. And so talking about testing, so genetic testing is something that you do. Is there, I'm just thinking about like working within the clinic. Are there tests that you use kind of in every situation just to get that baseline of data to put a plan together for people? How does that work?
Are you speaking about genetics or laboratory data?
Lab data or genetics, either one. Yeah.
So we only utilize whole genome sequencing when we're doing genetics.
Yeah.
We are in our infancy of knowing the power locked in the human genome, exactly where that lies. So we use a service that is constantly updated using AI algorithms. So as we learn more about a person's genome, then we know more and can take more targeted actions.
Right.
Blood work is obviously very important. So we do advanced biochemical panels on folks, which obviously go well beyond what insurance will pay for. So that's always included in our membership fees for our patients, because you're just not going to get insurance to pay for it. Plus, when insurance does pay for a test, then they own the right to the test results, and not everybody wants to share all that information with their insurance company,
Right.
especially your life insurance company. So
yeah, that makes total sense. Yeah. And so with regards to daily habits, what would be kind of maybe five things that you think in a day that would help somebody to get on that journey to better living, longevity, right? What are some of the things that are kind of key factors to that you would do every day?
So if we're gonna pick 5 things that we can all be mindful about every day, it's going to be that whole food diet, and avoiding highly processed foods. I might put that number 1 on the list, because we nourish our bodies with whole food, organic when possible. We poison our bodies with the highly processed and ultra processed foods. So we've got to be mindful of that. The second thing in importance, I would say, is getting that sunlight in your eyes in the morning. So that helps set your circadian rhythm, which is going to help your sleep. It helps get you in a positive mindset in the when you're out there getting the sunlight in your eyes. Hopefully you're moving. It gets your blood flowing, helps your cortisol come up in the morning, and you want your cortisol to come up in the morning. So, getting that sunlight in your eyes is going to hit a lot of factors. Another thing I would prioritize, it's hard to put these in order of priority because they're all so important, but is moving your body. And again, what to do and what not to do.
Right.
The things to do: hit at least like 7,500 steps a day. That is a reasonable basement. You don't have to do 10,000 steps a day. If you want to do that, great, fantastic. But if you hit 7,500 steps a day, the likelihood that you're going to die from anything lowers like quite a bit, like 20 to 30%. It's a lot. And then on the what not to do side, avoid periods of being sedentary. So sitting at a desk or sitting on your couch, watch television, doom scrolling, or working at your job while seated for most of the day, also very detrimental. And then another thing I would say is, and you could combine this. I'm big on habit stacking. So once you get a habit, combine it with another habit.
Yep.
And you can stack this on to getting your sunlight is starting your day with gratitude. If we awakened in the morning, then we all have something to be grateful for.
Absolutely.
And that, along with the sunlight, all that works to help get us in a positive mindset place. And we're just going to have a better day, and we're going to be better for people around us as well. We're going to be able to serve the people we serve better. We're going to be happier and extend our health span.
Absolutely. Well, and I love the gratitude, because it's true, right? And I find too, sometimes even just journaling for a few minutes before I go to bed to say what I'm thankful for, how today, what was I thankful for today, or what have you. I find that helps too, just to keep you present, right? And I feel like a lot of times, even if it's something small, I feel like sometimes we have goals, right? Everybody has a goal. If small, big, doesn't matter. We hit it, but we don't appreciate it once we get there, right? So sometimes it's nice just to sit back and go, oh, good job. Good job, Lisa. That was your goal. You hit it today. That was great, right? And internalize that and let yourself be proud of yourself about it rather than, again, kind of what you mentioned earlier, like we can be our toughest critic, right?
I completely agree with what you said. I am so guilty of not celebrating my wins enough. But every day we can pick out a win, right?
Absolutely.
And what we should be going for is progress, not perfection, right?
That is a good description. 100%. Yes. Yeah,
Perfection should never be a goal because perfection is unattainable.
absolutely. And it
Continuous
stands,
improvement is great.
yeah, and it stands in the way of progress
No, it really
because
does.
it totally does. It's
It is.
crippling because,
Yes.
you're always trying to get to that level. And if that level isn't achievable or it's unrealistic, it's just, you're never gonna, yeah, I feel like it's the opposite of progress.
Yeah, and you're never going to have a win to celebrate, right?
Exactly. Exactly. Okay, so you did mention a couple of not to do's. Is there anything else that you would put in there to say, I would not do this if I want to kind of enhance my health span?
So a couple of things. Smoking and vaping,
Mm,
people know that that is destructive by now, and vaping is just as destructive as smoking.
yeah.
I personally choose not to drink alcohol.
Hmm.
I, I cannot find any good medical argument of a way that alcohol is beneficial to our body.
Yep.
It's a neurotoxin, certainly a sleep disruptor. I just can't find high in calories. I just can't find anything good about it.
Hmm.
Uh, People are going to choose to drink alcohol, then they should keep it to 3 drinks a week or less,
Hmm.
and never more than 2 drinks in one sitting.
Mm, okay.
And
That's a good guide. Yeah.
I would also say, Lisa, that as women, we have to be so much more cognizant of the effects of alcohol on our bodies. Our bodies are so much more sensitive to the negative effects of alcohol than
Hmm.
the body. Our thyroid is sensitive to alcohol. Everyone's brain is sensitive to alcohol. Um, our heart, our liver in particular, there is another epidemic of liver disease
Hmm.
and ending liver failure in this country that is just starting to come to a head. But it is it is no longer a rare thing to see a woman in her 60s be diagnosed with fibrosis of the liver or hepatic cirrhosis.
Wow.
It's a
Wow.
big problem, and there's going to be such a demand for organ transplants in the future. People need to know and think more about that.
Yeah.
And these are ladies who just drink wine every day,
Yeah. Yeah.
and
Wow.
be able to drink the same amount and not have the adverse effects that it plays on our liver and our body system.
Yeah.
And just the fact it's such a risk factor for breast cancer.
Hmm.
Um, I, I discourage alcohol use.
Yeah. Yep. Well, and at the end of the day, too, I mean, again, we've that foggy thinking and all the things that come along with the how it affects the brain and your memory. And I mean, there's so much data, right?
And it's ever increasing,
Yeah. Yeah,
but
absolutely.
poorly known, I think.
I would agree, and I think as well, over the course of the past number of years, I think it became more of, I'll loosely say, a bit of a crutch, right? Where it was like this stress coping mechanism for people, right?
Hmm.
We saw the increase in Canada, anyways, of the number of people who would be consuming more alcohol than usual when they were at home and had to, right? And we were in the middle of world issues, that spiked and increased.
Sure did.
Yeah.
And hopefully, if people have not been able to kick that habit,
Yeah.
there is help
Hmm.
out there, and I would highly encourage them to seek help.
Yeah. Absolutely. Absolutely. There's always options, right?
Always.
because it at the end of the day, it's just a habit, and they can be changed at any point in time.
Absolutely.
Yeah. Yeah. Okay. So I feel like you've shared so much just about what to do, what not to do, some of the things to focus on. And what I love about your approach is that it's simple and clear and
Yes.
back to basics, right?
Yeah.
Because that's important. I have to ask though, because you're peptides. I do love peptides.
Yes.
What are a couple of your favorites, and what would you use them for within the span of health and longevity?
So peptides serve innumerable functions in the human body. Insulin is a peptide. Semaglutide, tirzepatide, those are peptides.
Mm-hmm.
A lot of peptides that you're going to see marketed on social media are not necessarily legal or good for you.
Right.
And I want to help raise people's awareness that some of these peptides can actually be harmful, right?
Mm-hmm.
You don't need too much growth hormone. Before I use a peptide to increase someone's growth hormone,
Mm-hmm.
I have a documented lab result that shows me that they are not producing enough growth hormone.
Yeah.
I don't use human growth hormone in itself, which is another peptide. I will use a peptide like CJC,
Mm-hmm.
and I like it combined with ipamorelin personally.
Yep.
That combination, which the FDA frowns on in the United States now, unfortunately.
Oh goodness.
But I like that combination to signal people's brains to produce their own natural growth hormone.
Mm-hmm.
The peptide I use in clinical practice the most is going to be those GLP-1s.
Of course, yes. Yep.
And tirzepatide.
Yep.
They have so many more positive functions than just weight loss. It's really helping people obtain better cellular health.
Mm.
And then
Okay.
another peptide that I'm is super useful in the human body when used correctly.
Mm-hmm.
Is going to be BPC 157.
Right. Yeah.
So that is injectable, again, frowned upon now in the United States on the injectable. But there is an oral form of BPC 157.
Mm-hmm.
BPC 157 was actually isolated from gastric juices, so it's naturally present in our GI tract. And if we put that peptide into our GI tract, it can be very healing to your gut health and certain gut issues. So
Yeah.
some of your peptides.
Yeah. You know what? I love oral BPC 157 for GI repair. Love it. The other one that I've tested out in combo with that one is lorazepam, oral lorazepam. That was good for gut health too. Definitely helped. And I do love my bioregulators. I use them about twice a year, right? My 20-day stints. So, when it comes to the liver and the pancreas and blood vessels and that, I definitely like those stacks for sure. I find that they're super helpful. Yeah. Visugen was an interesting one. It's the first one I ever used as an injectable. And that was back in, I think it was the beginning of 2021. I was trying to figure that out earlier on another call. But I actually, on my mineral test, I had a low sodium and I had trouble raising it, right? To really, get the energy back up. And despite using all the things in the sea salt and what have you. And I did one 20-day stint with Visugen, which was the first injectable I had tried. And it made a huge impact even on my sodium level in my hair. So I was really, that's when I went, wow, there's something to these, right? And then I started kind of diving down that multiple rabbit holes.
And they are powerful biologically active compounds.
Absolutely.
And because they have the potential to be great healing compounds and have tremendous benefit. Also, anything with that much potential that's biologically active can be harmful. So I would encourage people to proceed with knowledge, with a informed partner
Mm-hmm.
in peptide therapy,
Absolutely.
and not just get something off the internet and give it a go.
Well, and you've got to be careful too, right? You got to know where the peptide's coming from. How is it processed? It can't be large batch. Like, there's so many nuances that we have to be careful of. And you always, want to make sure you're using it properly under the care of someone who knows, but
Yes.
also sourcing a clean product.
Yes.
That's critical. Critical.
Agree.
Yeah. Yeah. That's really important.
We don't want to be putting more toxins in our body.
No, exactly. We have enough. we have enough that we breathe in every day and gets absorbed through our skin and, all the things. So we definitely have enough of that. All right. So for those of you watching, I just want to say thank you for tuning in to this episode. And for those of you listening on your favorite podcast host, make sure you give this episode a like, follow our channel. And I just want to remind you, we'll have all the links in the description, but Radiant Longevity, right? So you can find this on the website that we'll provide, and by Dr. Julianna Lindsey. Thank you again for joining us today, for talking about it, for giving us the information, those tips to do and what not to do. And again, you can find most of them plus a lot more in her book. So thanks for joining us, everybody, and I will see you next time.
Thank you, Lisa.
Thanks for joining us today on the Human Optimization Podcast. Episode technical production is by Grace Sylvester and guest booking by Stu Tate. Want to learn more? Visit LisaPitel-Killah.com for incredible free resources to supercharge your journey to becoming the best version of you. If you enjoyed this podcast, please like and subscribe to the Human Optimization Podcast and follow me on social media at Lisa Pitel-Killah.